It's been quite some time since I've seen you come in here. It's been, what, about 5, 6 months? So you must be ready for another cranial nerve exam? Alright. So, you know the drill. I'm gonna do the same things as normal. All you need to do is relax and we'll have you out of here in no time. First thing I need to do is make sure your information is still in our system as it was before. So your address is still the same? Alright. And it's been 6 months, so yes, you've had a birthday since last time, right? Alright. And no legal name changes. You'd be surprised, sometimes we get patients in here that actually have changed their name quite frequently, actually. But since you're already pretty much in the system exactly how it used to be, we don't have to do much more with that. But I'm going to get my gloves on and we can get started, and we'll get through this as quick as possible. So, a little bit different than last time. I see that you haven't had any blood or hair samples taken the past few times you've been here. So, I'm going to do some basic checkup procedures new to the hospital, just to make sure you're good and healthy on other parts besides just your cranial nerve. So I'm just gonna snip a couple pieces of hair. We're just gonna send it to a lab for testing. Just hold still for me. I know it sounded like I took a lot of hair, but just a few samples. And also, I'm just going to take your temperature, just to make sure you're not running a fever or anything like that. If you're running a fever, that can affect sight if your ears are plugged in some way. So we don't want that to mix in with the test results. So just open your mouth and just wait a few seconds. 3, 2, 1. Your temperature is exactly where it should be. So that's a very good start. So now we're going to move on to the audio part of the exam. Just like last time, I'm going to hold my hands up to your ears. And all I need you to do is point to which side of the head you hear the glove squeezing in. Alright? Good. Very good, very good. And one more. Good. So you aced that test. It's a very good start. Now what I'm going to do is use a different kind of noise. We're going to do the same thing, except now I'm going to use this piece of paper to crinkle in one ear or the other. So I'm going to hold it right above your head, and you have to tell me which side you hear it on more, alright? Okay. Good, good. Good. Very good. And one more. Very good. I'm just going to write down real quick that you aced those two tests. Alright. Next, what's going to happen is I'm going to come up very close to you, and I'm going to whisper a series of numbers into each one of your ears. All you have to do is repeat back to me what numbers you heard. So we'll start with this ear over here. 7, 3, 7. Yep. 4, 4, 3. Very good. 8, 0, 9. Yep, and one more for this ear. 2, 1, 7. Very good, very good. And now we'll go to the other ear. 6, 7, 8. Yep. 3, 3, 1. Very good. Yep. 2 more. 4, 6, 5. Absolutely. 1 more. 5, 8, 4. Excellent. You're doing excellent so far. And there's only one more thing that I need to test out with your ears. And that is not anything to do with audio like we've been doing. I just have to look into each one of your ears, make sure there's no immediate swelling or redness or any wax buildup that should be of concern. Pretty much just checking to make sure your ears are not infected in any way. So let me just grab my viewing instrument. So I'm just going to use this in your ears first, and then a little later on I'll use it on your eyes too. But just sit still for me. Okay, yes. This ear looks very, very good. Not too much redness or wax, anything like that. And the next one. This one also looks very good. bottom line is your ears are working properly. You got everything right. They look fine. So you got a 100% on that section. Next, what we're going to do is we're going to move to your visual cranial center. Just like with the ears, I'm just going to look into your eye. We're going to do it without a light at first, and then I'll shine a light in your eye to see if your pupils are dilating properly. But for right now, just let me look. Looks very good, very good. And the next one. This eye appears to be a little bloodshot around the outside, but nothing of concern. That could just be from rubbing it, or maybe a little dust got in your eye before you came in. So they look fine. Next, what I'm going to have you do, I want you to just follow the tip of the pen with your eyes. Don't move your head at all, just your eyes. All right? And now I'm going to have you do the same thing, except with a light. It's not too bright, so don't worry. But before we do that, I'm going to just, like I said earlier, check to make sure your pupils are dilating correctly. So I'm just going to shine this light in your eye. Check your eyes again. That one dilates well. And very good. So I'm just going to shine this light around your eyes. Don't move your head. Just follow the light with your eyes. All right, your eyes are tracking perfectly, just as they should. Now we're going to go to the color test. First, just to make sure that you can still see colors the way you should, I'm going to ask you what each of these sticky notes is color-wise. What color is that sticky note? Yep. And this one? Absolutely. And this one? And last but not least, okay, so we know we can tell the colors one at a time, but some people have a problem with shading. What this means is when you put two colors together, you may not be able to tell the difference right away. So I'm going to hold two of these up, and I want you to give a quick answer as to if the colors are the same or different. If you get it wrong, I'll ask you what colors they are, and we'll see what's going on with your eyes when judging color. So, first, are they the same or different? Right. And just to be sure, what color is this? Yep. And this one? Yep. That's the one most people would get wrong, believe it or not. Now this one, same or different? Different. Yep. And this is? Yep. And this one? Absolutely. Same or different? Yep. This one? And this one. All right. 3 for 3 so far. One left. Same or different? This one? And what's this one? Very good. None of them were the same that time. That's pretty rare. So, we only have 2 more tests left. One being a smell test and one being a taste test. Which one would you like to do next? I'll give you the choice. Want to do smell first? Alright, sounds good. So, what I'm going to do is I'm going to open these jars. They have a little bit of a scent to them. And you need to tell me what the scent is that comes out of the jar when I open them. Simple as that. And they're fairly easy. Alright. Just take a nice, strong sniff of this. Strawberry, absolutely. And now this one. Lemon, yep. And the third one's normally the most difficult. Can you tell me what this one is? Yep, pumpkin. I'm actually surprised you got that one. We normally give a very tough one. Even if you don't get that one correct, it doesn't normally tell us that something's wrong. It just means you don't have superb smelling. And you got it, so that means you have better smelling than the average person, so that's good. And so now we're going to move on to the taste test. So same thing, we have these little jars, and I'm going to take a Q-tip. I'm going to rub some of the substance off of the jar onto the Q-tip and just dab it on your tongue. And your job is to tell me what flavor you think that substance is. Alright, just open up. banana. Good, good. And let me get the next one. Open wide. Blueberry. Yep. And last but not least, grape. Are you sure? Just kidding, it is grape. Very good. You've aced all the tests. The only part of all of this that was less than perfect was your eye looking a little bloodshot, which, like I said, there's no cause for concern on that. So I'm just going to write down the test results. And that's that. But I'm also going to prescribe you very minor eye drops, just for the redness in your eye. If the eye drops, for whatever reason, do not take the redness and the bloodshot away, then I would come back and maybe get an eye exam of some sort, just to make sure there's no bigger problem. But the eye drops should definitely take care of it. And if your eye has been itchy, should take care of that too. But as for right now, that's everything. You aced the test, as you always do. And I'll see you back here in a few months. I'm sure you love your cranial nerve exams. Have a good night. Thank you.